Mankind has always been fascinated by how the body is connected. We have studied the skeleton, listened to the beating heart, tested the nervous system, measured muscle strength, and divided up the body piece by piece. Every organ has been dissected and analyzed. We've made great progress on so many fronts, but some of the greatest mysteries remain. The fascia, for instance, previously just seen as an insignificant membrane surrounding our muscles, organs, and skeleton, something we used to disregard and just throw away at autopsies. It's now one of the most exciting fields of science. Just another piece of the puzzle to help us see the human body as a whole. Today we know that the fascia is a network without a beginning or an end, and that it works in parallel with the nervous system and the bloodstream. But let's begin 500 years ago in Renaissance Italy.
The modern understanding of the human body is based on the fact that dissection used to be prohibited and taboo. So some enthusiasts dug up dead bodies and carried out autopsies to understand what we really look like. They did very detailed drawings. Leonardo da Vinci was involved in doing these kinds of drawings. And that was when we started to see the body as something you should divide up, in different parts and organs, clearly distinguished from one another. And eventually that leads to, let's study liver function, let's study how the lung work. And that generates a massive amount of wonderfully detailed knowledge. But this sort of knowledge, this type of mentality, assumes a fairly weak foundation for a holistic understanding. Because then you need to take a different approach. And we're not so good at that. It's not vitally ingrained in our tradition and culture to think in that way.
Industrialization, from the late 18th century up until the middle of the 20th century, pushed us to see the details rather than the big picture. It fueled our belief that everything can be substituted, everything can be replaced by a new worker, a new hammer, and eventually a new body part. The idea of human spare parts was forming. In schools, we started dividing everything into subjects. We all needed to know the same things and to learn them by heart, but without much thought for the deeper meaning behind them.
From a young age, as we grow up, our entire education system is built on dividing things up into different fields and subjects, starting at high school, if not sooner. I don't want to disrespect this method, as a detailed understanding is important. But if this generalist, almost philosophical approach is too dominant, if you believe that separation forms the basis for understanding, then it becomes very difficult. In the tradition of thinking we have become used to, holistic views seem somewhat intangible, which is problematic as the human body is interconnected. It's actually a whole.
So what happened to modern-day mankind? We'd rather take a painkiller for a headache than prevent the pain. And why do we insist on eating unhealthily when we clearly all know better? And where's the holistic view in our healthcare system? Maybe this is where fascia research can help us see all of mankind's needs.
In your first year of medical school, you get a cadaver and they cut it up, and you have to scrupulously tag everything as you're studying the body. The fascia you can throw in the garbage can. So it's almost like we're trained to not pay attention to it.
In the early 80s, we started jogging, mainly because it made us feel so good, a source of well-being. The gym and working out soon followed, and eventually we started talking about mindfulness and yoga. We started to look inwards. And it's in this context in which the fascia becomes more and more interesting, and for more and more people.
Vi öppnar vänster sida igen, andas in. Andas ut, trä genom höger arm genom vänster.
För det första, om man tänker att allting är fascia.
First, if you think that everything is fascia, so whatever you do will affect the fascia. If it is dynamic yoga, acrobatic yoga, or more peaceful yin yoga, then it will affect muscles, nerves, and skeleton in that all is fascia.
I och med att det är fascia.
Without fascia, there is no life.
Inget liv.
One group that spends considerable time talking about the fascia are yoga instructors. Perhaps not so surprising when you consider that few other professionals spend so much time working with the elasticity and functionality of the body.
Anledningen till att vi har börjat prata mer om fascia i yoga.
The reason that we have started talking more about fascia in yoga is that it cannot be ignored. You understand that it has to do with your immune system and how you feel, and if you then reach it through yoga, it will be impossible not to talk about fascia when you do yoga or exercise. And it comes more and more in all contexts.
Fingertoppar strävar till tårna.
Yogan bygger på helhet, att hitta lugn och ro i kroppen.
Yoga is based on wholeness and finding peace and tranquility in the body. What we try to do with our treatments is to get the body to change itself and start a flow so that the body rebuilds itself. The cool thing about yoga and Pilates people is that they have good body awareness. They quickly feel that things happen, which maybe ordinary people don't, because they're more sensitive in that way. The fascia is a whole, the body is a whole, and yoga is a whole that is based on understanding breathing and movement. Therefore, it is perhaps more natural for them to talk about fascia as a holistic perspective. It may not be as natural for a physical trainer to do that. They talk more about muscles.
Och det är också väldigt intressant när det kommer gymfolk in på mina klasser.
It's interesting when gym people come to my classes who have been standing and pumping up their muscles and looks very strong, but they have no function in their body and cannot use their muscles. I don't want to have muscles for show off. I want to be able to use them and feel that they have a function for my body.
Har en benefit för min kropp så.
Fotbollsspelare, hockeyspelare.
Football players, hockey players, I think all elite athletes train far too monotonously. Fascia, yoga and Pilates may come in as a supplementary training method to prevent them from breaking.
Träning för att de inte ska gå sönder.
Rygg eller handen. Så vi kan lyfta lite i bröst.
Hälsa är viktigt och det är många som kommer att försöka.
Health is more important, and I believe many want to see themselves getting healthier, and also that nutrition and good exercise is good for staying healthy for a long time.
När jag tänker kropp och hälsa så tänker jag direkt på min...
When I think of body and health, I immediately think about my own machine, the body I live in, and I want it to last. It's in my interest to take care of it to be healthy. You're listening to Fascia Guiden, a podcast about the body.
Ja, en kompis hörde av sig till mig.
A friend of mine got in touch and told me there's this amazing podcast that I had to listen to. They talk about tons of stuff that I'm interested in, but in Swedish. A lot of this information is available in English and loads in other languages, but being able to hear new findings on this subject in Swedish was so cool. So I started to binge listen to Fascia Guiden.
Man bråkar ju lite grann om vad fascia är för någonting. Vad räknas som fascia? Är det interstitium som man har pratat om? Är det den extracellulära matrisen? Är det kollagentrådarna? Är det fibroblasterna? Vad är det egentligen som ingår i fascia?
När jag snör in på någonting så blir jag lite manisk.
When I get obsessed about something, I can get a bit manic about it. I really need to understand it. So I contacted Fascia Guiden and attended a workshop. It was a 5-hour workshop and I learned masses about a holistic view of the body.
Och även använda...
And I got to use their machines and release some tension that I have in my feet and joints and some old dancing injuries. And it works and I feel enriched. I feel like, damn, I found something that works.
Berikad. Jag känner så här, shit, jag har hittat något som funkar. Får jag igång någon kräm i den här eller? Det är ganska sjukt egentligen. Man går i skolan, man läser lite biologi, får någon slags...
It's actually a bit crazy. We go to school and study some biology, gain a basic understanding of how the body works, there's a skeleton that holds it all together, and some tendons and muscles that help you. It's just so basic.
Och sen, när jag snöar in på det här med fascia...
When I really got involved with the fascia and learned about hyaluronic acid, which absorbs pressure to the body and acts like a sort of shock absorber, I didn't even realize we had functions like that in the body that could behave in that way.
Att det fanns något som kunde bete sig på det sättet. Och att det...
And that this flows through the fascia network that keeps the entire body in contact. Suddenly I felt like, wow.
Okej, wow. Och jag återkommer till liksom, verkligen säga maskin för att
And I keep coming back to the machine analogy, because the self and this machine I inhabit are also two completely different entities. So this is an outlook I have on life. If you have one car for the rest of your life, you get just one car. You're going to take care of it. And it feels nice to have found my home, to have found friends and like-minded people.
Likasinnade människor som tänker likadant som jag.
One of the key people behind the Fascia Guide podcast is an economist turned chiropractor who then became an inventor, Hans Bolin.
Det är viktigt att få svar på varför om man har ont.
It's important to get answers as to where we have pain in the body and what the issue is, rather than just curing symptoms. People becoming healthy is a good start, but we started looking at why they were getting better, what sort of mechanisms are getting in the way. And that's when we started looking at connective tissue and its functions, what we call fascia or connective tissue, and how much it matters to the health of mankind.
Over 10 years ago, out of curiosity, Hans and his son started to test various forms of treatments. They soon came to realize that a healthy fascia could form the basis of a life without chronic pain. To start with, they focused on why there were so few mechanical aids for treating shoulder, back, and hip pain. But that led to work on gathering as much knowledge as possible about the fascia.
So I was a trainee chiropractor, and that teaches you how to manipulate. The annoying thing is that clients keep coming back all the time, because they're not really healed. So I had two competent friends, an engineer and an industrial designer, and we tried to make a machine. But building machines is not that easy as it seems, but we developed it and started testing it. But the fact that it then worked as well as it did was a bit of a shock, because I said, well, if you remove the pain, how will that work?
It's actually quite challenging to put into words what the fascia is. Basically, it's a network of connective tissue with no beginning or end, and it surrounds virtually everything in the body, from muscles and the skeleton to organs and cells. Imagine that every part of the body is wrapped in connective tissue. These webs are in turn connected together and form one of the body's basic frameworks, holding everything in place. This web throughout our body is the fascia.
Historically, I'm a pathologist, so I sit looking at human tissues under the microscope all day long. That's not the same as looking at living tissue, though we pretend it is. But now we have a scope that looks at the living tissue, and it doesn't look like what we thought.
So fascia is, let's say, almost 1/3 of our biomechanics. And now we have a hard data that support how fascia is important for us.
Because now we have understood that the fascia can connect the different part of the locomotor system. I have not understood before this mechanism, because we can really improve the treatment of our patient, understanding this type of connection through all the different elements that form our body.
It seems clear that the fascia is of vital importance for all our muscular movements. But it's at work even when we're at rest. Our immune system, for example, needs the fascia to keep us healthy, and the fascia works to reduce our pain in case of an accident. If you bang your foot, knee, or hip, it's the fascia that absorbs some of that pain. You can also imagine the fascia as a web of thousands of thin cotton threads working alongside one another. If the threads get tangled, it can be a problem. The body can handle it to a certain degree, but not always.
A typical example of something cool that we do. This is a poster, a presentation from the Fascia Research Congress in Berlin 2018, where we interviewed a lot of scientists and attended lectures. 2 discoveries were made there that were so immense and revolutionary that it's very odd that nothing more has come of it. They were both made by a woman named Carla Stecco, who is a professor of anatomy. One of the discoveries is that there is a brand new cell running throughout our bodies that we didn't know about until now, fasciacytes. This cell produces the lubricant that allows the entire body to function. So when you move, and you're able to move well, it's thanks to this cell.
We have discovered a new cell inside the fascia that we have called the fasciacytes that has a different behavior and is able to create the gliding surface of the different fascia.
The second discovery is almost even more amazing, as she discovered the estrogen and other sex hormones affects what is known as fibroblasts, which is the cell that builds up the collagen structure in the body. What she demonstrated was that women's bodies rebuild themselves twice a month. So when you ovulate and menstruate, the body actually rebuilds itself. And this is another explanation for PMS and for other types of illnesses related to women, such as fibromyalgia and hypermobility. And when you start to look at the potential this might have, if we dig even deeper into her discoveries, we find enormous potential to make a difference for women who are displaying all sorts of symptoms.
Alla de här kvinnorna som går runt med diffusa symptom.
Carla Stecco is an orthopedic surgeon and professor of anatomy at the University of Padova in Italy, and one of the world's leading scientists in this field. As well as her discovery of a new cell, she is also researching what causes pain to occur in parts of the body not impacted, for example, by a trauma.
This is the Galileo room. The student create a podium to stand up Galileo and to permit to all the people to see Galileo.
Padova is home to the world's oldest anatomical theater, previously used for dissecting bodies.
Now I see the history of Padova, but I see also the future of fascial anatomy and the fascial research, because in the past the human body was cut in many different pieces, and we learn about the liver, about the stomach, about the different muscles, the joint, and in such a way we lost the global view of the body. Fascia was really totally forgotten in the past. They were not able to see the innervation of fascia, and consequently they considered the fascia just as an anatomical structure without a true importance. Now we change the perspective because fortunately we have understood the role of fascia and that the different elements interfere one with the other, that all the elements are connected each other. Ma dai, fantastico! So we decide how the hip can interfere with the back, with the knee, how an old trauma in the ankle can create back pain. If we understand that connection, we take care in a different way our patient. Maybe then we need also the neurosurgeon, the orthopedic surgeon, but before we have a global vision of the patient. And I think that can change really the medicine of the future.
Someone else who sees the fascia and its importance from within is physiotherapist and ultrasound expert at Sweden's GHP Sports Center, Niklas Norlén.
And there you can see the movement. And it should also move here in this other musculature. And so everything has a dynamic, with connected movement as you can see. If we look further down here, we can feel the bone. And if you then move your fingers, you can see how they glide against each other. Here we can see a fascia gliding against the lower muscle belly of the muscle. And here is a fascia gliding against the upper part. And how thin these fascia are when they're healthy. So there isn't much friction and they just glide against one another.
Och skapar inte så mycket friktion utan att det bara glider jämfört mot varandra då.
The good fascia is a fascia that is very well organized, so with all the collagen fiber, with a precise direction that permit to connect as a bridge the correct part of the body, and at the same time gliding surface that permit to move respect to the surrounding tissue.
Förut så var det ju liksom bara att man läste.
In the past, you just studied anatomy and learned about the existence of the fascia. But we didn't really understand the dynamic and the function in the same way as when you work with ultrasound. You understand how amazingly dynamic it is. and how important it is that it's able to glide, and the small scarring and old wounds can mean that it doesn't really function as it should, and that this can cause pain.
When the fascia starts to be altered, one of the first elements that we can see also with the ultrasound is a lack of gliding. It's like that the two fascial layers, or the fascia and the nerve, or the fascia and the muscle, are attached and don't move. So if we start with manual treatment to create a friction, after 1-2 minutes, we feel that this stuck tissue starts to move, starts to glide.
So the lighter parts you see, especially when I move the probe across here, you see the white fascia lines that surrounds every muscle. And here in the calf we can also see fascia strings. Here's another one, so they can be found in every muscle belly. And a lot of injuries lie between the muscle and fascia or in adjacent structure, so that affects the ability to glide and the ability to stretch and move muscles and tendons. And this can often cause problems that they don't glide as well. And that can lead to symptoms that the muscle can feel pulled or stretched, that it feels less flexible, and that new injuries can occur as scar tissue starts to build. But our lifestyle and what we do all affect the body. Our sleep patterns, what we eat and exercise, we can see that on the ultrasound too. People who exercise, eat well, they have a good structure and it looks healthy, we can see that. We might get younger people who don't exercise or have a chronic disease or something and have a much older structure than their actual age. So it's definitely important.
We have a precise anatomy into the fascia that connect the body in a precise way. So we have some line along the body that permit to connect the feet with the knee, with the hip, with the back, until the neck. And all that elements are organized in a very precise anatomical way. Here we can see a small piece of fascia, and particularly this is the galea capitis. You can see also as inside there is a small vessel that we can see here, and also some muscular fiber like that or like that create a specific tension into the fascia. So we can imagine that if after, for example, whiplash, we create a contraction of this muscle creates like a tension inside the fascia, like that modify all the structure of the fascia. And it's for that the fascia is a bridge that connects all the different elements together. And without the bridge, and without considering the bridge, is impossible to understand the human body.
Fascia that have become tangled or gone through a trauma will affect a person's movement. And because recent discoveries show that there are 6 times more nerve cells in the fascia than in muscles, fascia problems can be linked to pain in the lower back, shoulder, knee, anywhere the fascia exists.
Why is fascia so difficult to understand and complex to understand? It has several impact factors.
A diseased fascia can soon become a vicious circle. It becomes inflamed. The flow of fluids in the body as well as the immune system are affected, and the pain itself impedes recovery. And considering the pandemic of back pain around the world from our increasingly sedentary existence, it's no wonder that more and more people are becoming fascinated by the fascia.
And the most important thing is to know that now we can't imagine the human body made of separate parts. It's a global, and it's completely new. It's a paradigm shift. But this paradigm shift make able to introduce new fields of science. So we can have links with mathematics, with physics, with biology.
Det som först fascinerade mig med.
What initially caught my attention with fascia was the fact that it's the real thing. Like, wow, it's really amazing to understand the body, that I have a body and that I can learn to understand it, and that I know so little about my body, I know so little about myself.
Along with the clinical studies over the last 10 years, the Bolin family has made practical progress and has thereby been able to confirm scientists' discoveries.
We treated a lot of people. They came to us with all sorts of problems and they got better. And we were thinking, how? How can people be getting better with treatment from this machine? Because we're really not doing much. We're making sure the body's aligned and balanced. How can these machine treatments give such quick results?
Basically, the rhythm of the machine put the body's fascia into a wave pattern. So when you treat the neck, you can feel it in the foot and vice versa. The conclusions they've drawn from this are that the fascia is a system that affects the well-being of the entire body. But as we know, it's not sufficient that we ourselves understand the connections. We need to be able to explain them for others, and above all, implement successful treatments in the long run.
Around this time, we started contacting and meeting various scientists. We went to the US, Germany, and around the world. We talked to scientists who are researching how the body really works.
Nowadays, we're able to look at the connective tissue. We can see that it contains nerve cells, it contains nerve receptors, lymph vessels, blood vessels, and so on. So all of a sudden, we realize that there is a true connection from structure to structure, and the connective tissue is the one who actually is connecting.
When you realize that there is a new tissue, or that an old tissue has new functions, and you have tools to measure it, and that people are collaborating a lot, and you get new discoveries every month.
Why is fascia been neglected? The first anatomists wanted to understand the organ more as in a system-based, but they forgot the holistic view of the human anatomy. So instead of isolating organs, now we really understand the importance of the interrelation between organs, which is mostly done via fascia. So this is like a complete organ in itself that is organizing all the other systems together. If one segment of your body is affected due to like a trauma or anything, so it's easy now to envision that this tension can be actually migrating into your fascial network and will basically lead to secondary symptoms that will be described as painful in other regions that the patients will be consulting for, which are far from the initial, problem.
To start with, it was all about launching the machine. But at the same time, it's been important to demonstrate the effectiveness of the treatment it provides. For example, here at the Swedish Embassy in Helsinki, Hans Bolin treated a frozen shoulder. In traditional healthcare, this has been difficult to do, but in 2019, a study was published that proved that the treatment helps patients with frozen shoulders.
Frozen shoulder är nog ganska gåtfullt.
Frozen shoulder is a somewhat mysterious phenomenon. However, I'm certain that it originates in the soft tissues.
Dr. Håkan Borg has made a pilot study on frozen shoulder treatment with deep wave therapy, and the results have been beyond all expectations.
They are in a lot of pain and have low mobility. There's a loss of mobility, and that's typical of a frozen shoulder.
Frozen shoulder has been a tough problem in healthcare. That's something everybody agrees on. There have been several different treatments, everything from physiotherapy to cortisone injections, sometimes even operations. All treatments have been time-consuming and with a lot of pain along the way, and not always that successful.
My colleagues are stuck in old habits and conventional physiotherapy, medication, and in worst-case scenarios, cortisone. We have been offering operation, but that hasn't been successful. Bad results.
The results of this new fascia therapy caught the attention of Dr. Håkan Borg, who noticed they were far better than those found in traditional healthcare treatments, and he wanted to take a closer look.
I saw the potential to do good things for patients that have been suffering for a long time.
This is why he made the pilot study, 23 patients, all diagnosed with frozen shoulder. The study was conducted during 37 days with 3 treatments of 40 minutes each.
Det som är hemligheten med maskinen.
The secret of the machine, well, actually it's not a secret. The machine has nice and soft frequencies that the body accepts easily. Because it feels nice, it makes the body relax. You can measure the possible degree of angular movement in patients, which lets us see that this actually works. You can see the mobility go from about 30 degrees up to 180 degrees.
17 patients completed the study. One patient regained full mobility after just the first treatment. 41% of the patients had full mobility after 3 treatments, and 76% of the patients could move their arms 45 degrees more than before. In addition to that, 71% reported that the quality of sleep had improved, an unanticipated positive side effect.
It's fantastic if you can potentially make an improvement of 60 to 70%. It's a great success. I think this has been fun, and still is.
En sak med maskinen.
One thing about this machine is that it increases the flow rate. A good therapist with good knowledge and this machine will get faster and better results. I never would have thought that you could cure a frozen shoulder in 1 week. A real eye-opener for medicine. In the study, we treat the actual shoulder for about 10 minutes, the first time, because we treat the whole body. So it's like a lot of scientists agree upon. Pain in one place of the body can originate from another place in the body. So it's important to balance out the whole body and increase the flow rate. I don't think people have understood how good this Fascia Vibes treatment is. I mean, you add so much energy when you use a machine. The important molecule here is the hyaluronic acid. That's what we do here. Loosening bindings in the hyaluronic acid. That's still the main thing. You see, when you're adding energy, you will loosen up these bindings.
The hyaluronic acid is the lubricant of the fascia. Hockenborg believes that in a frozen shoulder, the hyaluronic acid has turned from lubricant into glue.
This used to be a question of months and years. Now we're down to about a week.
There is a space for a new standard in well-being.
I think it's a good feeling here and great people from different sector, health sector, therapist sector. I think everybody are quite curious about this new way of treating. That's the key for their success.
She has had a problem with her shoulder, have a frozen shoulder. We'll see if we can have it released. The problem is actually over there and over there. So we're going to lose it, not go to the problem area, but go to the loosening it up before going there. It's more pleasant that way.
I'm really surprised. I didn't think that it would work for like 5 minutes.
10 minutes maybe.
Yeah, maybe we did this.
But it was really good with.
Yes, with that. I'm really surprised. Really surprised. Yeah, it feels really nice.
And you were a real frozen shoulder.
Well, I don't know. I didn't know that it was called that. I just knew that I couldn't lift my shoulder or my arm up in a certain way. So I didn't think much about it. I just thought that I was stiff. That's it.
And how does it feel now?
It feels a bit sore, but still, I mean, I feel a lot more relaxed.
And you're not an actor?
No, I'm not an actor at all.
I work a lot with athletes and I use it all the time.
Why it's so good?
Mostly because of the vibration, and it's so hard to make the vibration by using only your hands, and you get deeper without causing pain. That's something you cannot do with other machines.
The success continues in the US, England, and not least, Germany. But at the same time, Swedish equine massage therapists have shown an interest in the machine and the method, leading to several tangible results, since placebos aren't relevant with animals. Harness racehorses were measurably faster, and star show jumper Rolf Göran Bengtsson has shared the positive results he's seen when his horses jump.
We notice early on that if the rider is unbalanced, then the horse becomes unbalanced. That connection between man and horse feels obvious to us. With the Fascia clinics and Fascia horse, we have found a concept where these two meet.
These are conditions that affect the horse's pressure in the body.
Since 2019, Camilla Rania Nordin has been compiling one of the world's largest fascia research databases.
As an animal scientist, you are very focused on. We talk about how we keep the animals healthy to make it as economical as possible. Any animal that gets unhealthy costs a lot of money.
Den här hästen verkar ju hyfsat bekväm.
This horse seems quite comfortable. It has calm eyes and nostrils. The good thing is that our way of thinking and treatment with our machine makes the horse feel better as a whole. It moves better, is simply in a better place and stay healthier.
Rör sig bättre, är på en bättre plats helt enkelt och är friskare. Så som den är konstruerad så kommer den...
The machine is designed so that it gets deeper and wider. You can treat in one place and also have a great effect in other places. It can be difficult to achieve with manual treatment or other machines.
Här inne sitter en lite starkare fascia.
Here there is a firmer fascia structure. Here you want to use the semi-blunt or pointed tip so that you can more easily reach the deep fascia inside. Then you can lose up a lot of tensions. It is usually very clear how the horse behaves, moves or stands before and after treatment.
För och efter behandling.
Vi vet hur hästar rör sig. We see how the horse moves. We know how to maximize the effect and give the horse the best conditions to train and perform well. But that's not all we're looking for. How do we get the horse to recover after performance or to rehabilitate after injury? But also be that best friend as it is for the horse owners, making the horse feel good and gain body awareness and improve proprioception, that nothing is stopping them from full motion.
Den här hästen har ju fått
This horse has got quite a lot of treatment. He's one of our regular customers. You can see that his nostrils are pointed out and that he has wrinkles around his mouth. It is a sign that he is in pain. This is what we call a pain face. We are trying to help him become more relaxed.
Känner du skillnaden?
Do you feel the difference when you've been holding on for a while? Absolutely. Then you can move on to the next place.
Jag skulle vilja säga att det är väldigt viktigt i väldigt många...
This is very important both in rehab and prehab. If you have a horse that works hard, it will incur tensions. You know that yourself. If you have run or exercised hard, you got muscle soreness. This treatment makes you recover better. The treatment also stimulates the healing of injuries as a result of increased fluid flow. It helps you stay healthier.
Om du har en skada så hjälper behandlingen, den stimulerar ju läkningen så att då hjälper det igen tillbaka till att bli frisk.
There's no question that horses get better from this treatment. It's movement, just like for humans, that causes the layers of the fascia to glide against each other, helped by the hyaluronic acid, a lubricant that also helps bind water to the body. A sedentary lifestyle and a deficit of hyaluronic acid makes the fascia stiff, which can cause inflammation and pain in the body. Internationally, interest in the fascia has grown enormously in the last decade, and we are definitely heading along the right track.
Och det är väl någonstans poängen att försöka ge kunskap.
And that's kind of the point, trying to inform people about the body in a simple manner, so that people can learn to live with their own bodies. Because if you feel well and can get to know yourself, you can take more intuitive decisions and feel secure and feel better and in turn treat other people better. But in reality, this is not the case. It's actually quite difficult to stay healthy. It's super difficult to eat healthily and to get enough sleep, to avoid stress, to avoid being affected by chemicals in our food, by our surroundings and in general. There's so much going on all the time and it becomes difficult to stay healthy.
Det är så mycket som händer hela tiden som gör att det är svårt för oss att hålla oss friska.
Dansen har varit mitt fria rum där jag kan vara precis.
Dance has been my free space where I can be exactly as I please. Express myself without needing to talk. Just be able to express my feelings physically. And it really was my life.
Verkligen. När jag var 13 så blev jag uttagen till en...
When I was 13, I was selected for a high-level dance group which involved a lot of dancing, a lot of classes each week. We had a lot of pressure on us to constantly improve. You can stretch even more, become even more agile, improve endurance even further. And I think that has taken its toll on my body. And at such a young age, you shouldn't have to think about or question what it's doing to you. You're so consumed by what you're doing that you do anything to be the best and go the furthest.
av det man håller på med, det man älskar, att man gör allt.
And today it seems it's taken a greater toll than I thought it would have back then.
Nu idag har varit en större belastning än vad jag nog kunde förstå att det var då. Jag upptäckte
I discovered quite recently, or just a few years ago, that I was in pain. My feet were really swollen, especially my ankles. It was uncomfortable, and it would hurt if I sat still for too long. Flying was really tough, as I couldn't get my shoes on afterwards, and I was really self-conscious about how it looked.
Och blev väldigt liksom självmedveten kring hur det såg ut. Jag hade egentligen inte så mycket förväntningar.
I had no expectations in particular as to how it would help or even what it was. At first it felt really strange. I started laughing because I thought it felt odd.
Jag tyckte det kändes lite obehagligt.
But he mainly focused on my feet and under my feet. And when I stood up after the first treatment, I felt a relief in my entire body.
Så kände jag en lättnad i hela min kropp.
I don't get nearly as much pain and swelling. I feel at one with my body, which I haven't done for a long time.
We all know how difficult it can be to navigate through research reports. So to help bridge a common gap, the idea is to disseminate know-how via the Fascia Guide podcast in a modern and accessible way, but also by training therapists in practical treatments in Sweden at a clinic in Sollentuna.
Den här delen är ju väldigt central egentligen i allting som vi håller på med, allting som vi gör.
Vi startade egentligen utbildning för att det inte fanns någon.
We actually started this program as there was no other training that was about the fascia and using the fascia as a perspective, about connecting the parts and forming this holistic view. So we actually created a program to fill a gap in the market, but also to find a structure and the process as to what a therapist actually does in their work.
I sitt arbete.
Deras sätt att tänka på har fått mig att öppna ögonen.
Their way of thinking has really opened my eyes because I work with jockeys and their posture, body and balance. Jockeys often have pelvic obliquity, a misalignment of the pelvis causing one leg to be longer than the other. So this is going to make a real difference for me when I work with jockeys, for sure, as it will streamline everything, to be honest.
Det kommer effektivisera allt egentligen.
Det fascian gör är att ta emot och avlasta tryck.
The fascia loads and unloads pressure. There's a lot going on and we're put through a lot that the body has to handle. So the fascia explains why we're affected by our surroundings, but also what we can do to be healthy.
Också vad vi kan göra för att må bra. Här kan vi försöka...
We're able to try and understand things differently and see the body in a different way. And that's also what's given us these results. Daring to look for solutions where no one else has looked, not just treating the symptoms, but trying to solve the problems, and asking where something is coming from and what we can do about it.
In the past, I was convinced that the fascia is just a connective tissue with some collagen fiber, some fibroblasts, and it's all. Now we know that there are many different cells, and we need to study all the cells, how to answer to the inflammation, to the hormones, to the aging, to the food, and all that aspect need a specific research. And only creating a group, an international group that look about the different topic, we can really understand the fascia. It has to be autonomic and probably from the ganglia.
So they will go from the celiac.
In the past, I've thought as a fascia as one fascia that was almost the same everywhere. Now we know that we have the superficial fascia, the muscular fascia, the visceral fascia, and all that element have a precise anatomical aspects, different innervation, different fibrous component, different cells, and answer to different mechanical input. That element interact each other in a very precise way. So the organs through the fascia, through the visceral fascia, are connected with the locomotor system, with the muscle. And maybe a person that have a chronic abdominal pain, start to have also back pain, or start to have pain in the neck. And only if we understand such interaction, we can really care the patient. Actually, the people are treated just with the pills that reduce the symptoms, reduce the pain, but don't care really the fascia, don't restore the proper anatomy of a fascia.
Och det är som, det var någon som frågade Carla Stecco så här.
Somebody asked Carla Stecco, shouldn't you do a study on men and testosterone and male hormones? And she responded that, you've had your years, it's time we focus on women now, as apparently 95% of all studies are done on male subjects. And animal studies are done on male mice and not female mice. And if you do a study on a female mice, hormones will be an aspect that get in the way. They have too much of an effect, so they're moved, because otherwise it's too difficult to study what you want to, because the hormones are there getting in the way of my results. And that's ridiculous, as that's the point, that there are hormones there getting in the way. And that's what we need to understand, to in turn be able to understand women and women's pain.
Det började med att jag fick förvärkar som var väldigt milda.
It started with very mild contractions. Then the contractions became more intense. They were so powerful that I got chills, and it was really difficult for me to focus on the breathing, which meant that I was very tense. Then Kayan came and helped me with this amazing machine which allowed me to relax and focus on my breathing again. And it changed the whole process, so it was so much more comfortable and fantastic.
Det gjorde så att hela processen blev helt så mycket mer behaglig och fantastisk.
Och jag försökte med mina vanliga tricks att få ner henne i lugnet.
I tried my usual tricks to get her to calm down, but I couldn't do it. And I remembered that it wasn't even worth asking, because Anne was pretty much unreachable. So I took out the machine and thought, it's now or never. And then I just sort of placed it against her back like this. And I asked if it was okay, of course. And I basically got a yes straight away.
Och jag fick ja på en gång i stort sett.
She saved me. 10 minutes later, she's twitching like a sleeping puppy, and I just thought, this is just wonderful.
Från panik 10 minuter tidigare.
From panicking 10 minutes earlier. But she did wake up when the contractions came, but this time she was so calm. I think it brought her inside herself, and the pain lessened, and she had a sense of calm and security.
Och jag var glad att jag var väldigt...
And I was glad that I was open to that suggestion, as it was an enormous help. And then every time is completely different, but this time it came to the rescue.
Och jag fick en fråga en gång från när vi la upp en annons om att vi behandlade en frozen shoulder.
And I was once asked when we put out a post on how we treated someone with a frozen shoulder in 7 minutes, from not being able to move their arm to lifting it all the way up in 7 minutes. And someone said, I don't believe it. It's not possible. I've treated loads of frozen shoulders and results that fast are not possible. So I said, do you address the pelvis when you're treating a shoulder? What? And the feet? Sorry? What do you mean? Well, we always start by treating feet, knees, hips and back when we treat a shoulder. Oh, like that, he said. Yes, because you need to include the entire structure and body if you want to solve the problem with the shoulder, as not being able to lift your arm affects everything.
Det påverkar ju allt. Fascia-kliniken är resultatet av allt.
The Fascia Clinic is the result of everything we've done in the last 10 years. We're basing it on a research database of 3,000 articles. We've created a machine that's been around the world and been visited, and that's why people come here with pain and leave without it. This isn't for people looking for a quick fix or a miracle. It's for people who want to gain knowledge as to how their bodies work.
Vill få kunskap om hur min kropp ser ut.
So that's what this inauguration is for today.
Jobbar med idrott och fotboll hela mitt liv och även utbildar mig tid.
I've been working in sport and football all my life, and I trained as a physical education teacher, but I haven't heard so much about the fascia. But now we understand how important fascia is and what it does for the body. Lots of players have come to me with problems with the calf, for example, and we've treated the calf, and the player's been okay or fine, but then it's injured again. And I've always said that the problem must be somewhere else. Maybe we shouldn't be treating the calf, but somewhere else in the body.
Det kanske inte är vaden som vi ska behandla, det kanske sitter någon annanstans i kroppen också.
And when you learn about how the fascia works, that's very much the case. So I think you can get players, sports people with problems to improve, but also get them back from injury quicker, because circulation is improved more quickly.
Att få bli bättre, men också att snabbare komma tillbaka efter en skada, för att flödet kommer igång snabbare.
This is also a bridge between Western and Eastern medicine, according to Professor of Medical Qigong, Fan Shulan.
It's a modern and scientific way to understand what's being talked about in Chinese medicine for millennia in terms of what we call meridians and points that send signals about the effects of healing around the body. What's been difficult to explain is how these signals have been communicated around the body, thereby making it easy for us to understand the effects on our health this method has. With the intention of solving people's problems in the West, this could prove to be a wonderful tool, for example in elderly care.
It's all the same human body, and we just have different perspectives on it. And I think part of what's going on here, if we're all talking about the same body, then maybe the issues that separate us are all about language and metaphor. I think this kind of work is starting to allow us to see where they meet. And if that happens, then you'd be talking about global medicine and global health rather than Western versus Eastern and that kind of thing.
Det finns så mycket man kan göra med.
There is so much we can do with treatment, diet and nutrition that will actually make people healthy.
Very interesting.
And we've spoken to a lot of doctors that are thinking similarly. So there's a new wave in medical science that covers the use of nutrition as medicine, looking differently at how we eat and finding cures that way. Look at the intestinal flora, mobility and breathing and so on. And this is a new wave approaching. How can we stay healthy in a more natural way?
Hur håller man sig frisk på ett mer naturligt sätt?
The best will be to understand all the elements that can affect the fascia and to prevent the alteration of fascia, because I really think that if we are able to understand all the elements, we can avoid the aging, we can avoid the degeneration of the joint, we can avoid many different pathologies in the organ, in the muscle, in the joints, and consequently it means that we can become older in a better way.
Det kompletterar ju hela världsbilden, men jag skulle...
It certainly complements our worldview, but I would even go as far as to say that it changes our whole worldview. I can see how this will lead to new forms of healthcare, new lines of research, new perspective as to what mankind is, new institutions. Yes, a very different view of human beings.
Ja, en väldigt annorlunda människosyn.